Welcome to the Crescent City, where Vital Options is in New Orleans with ASH, the American Society of Hematology. Please define public policy. People say, what does that mean?
So I was looking it up, our friends at Wikipedia. Courses of action, regulatory measures, laws, and funding priorities concerning a given topic. Courses of action, regulatory measures, laws, and funding practices. So things that we talk about a great deal. So public policy in cancer is, where do we prioritize where the dollars go? How hard do we make it? What are the regulatory challenges to developing and approving a new therapy? What are the laws around who can get access to the therapies we want? So we're going to talk about the Affordable Care Act in a little while. And so as a community in cancer, the thing that public policy is important to us, we have to decide, what do we value in those policies? How do we want them to be written to ensure that our patients can ultimately get access to new therapies quickly, new treatments more appropriately? So we focus on public policy that's driving new innovation and ensuring access.
I remember during one of my first interactions with some lymphoma patients, when I first joined the Lymphoma Research Foundation and began to speak about public policy, I was stopped partway through my presentation, and a patient asked me, so when you're talking public policy, are you talking, remember Schoolhouse Rock, how a bill becomes a law, I'm just a bill? Is that what you're talking about? And what the heck does that have to do with my lymphoma? And for me, it gave me pause and made me think about the way in which patient advocacy organizations relay the importance of public policy, both on the legislative and the regulatory side, to our patients. And so instead of starting at the 30,000-foot view, I think one of the things that our organizations try to do is illustrate to patients the impact public policy has on their lives. So I'll give you one quick example. We've been working very closely in this era of personalized medicine. We know that more than 30% of these new therapies in the pipeline are oral oncolytics. It's very exciting for many of our patients. They like the freedom from the infusion chair. These are much more targeted, in some cases effective therapies. Unfortunately, we've heard from some patients when they go to adjudicate their prescription, they are often exposed to huge cost-sharing requirements, sometimes in the thousands of dollars per month in order to access their medication. That's a public policy issue. We've been attempting to educate lawmakers about this problem. We want patients to access these therapies, and we also don't want to stifle innovation. If patients can't access these therapies, we may see industry sponsors, even government sponsors of some of the trials developing these new medications, really wondering if it's worth their time and effort to produce these if patients can't access the therapies. And so one of the things our two organizations have been working on for the past 18 months is legislation which would create parity between oral chemotherapy and IV counterparts. And we kind of get into the complexities of benefit design, but at the end of the day, these advocacy efforts are really education initiatives. We've both worked bringing patients to Capitol Hill to educate lawmakers about these new therapies, the way in which it impacts their lives, and how important access can be. So I think when we can take these very complex policy matters, break them down for our patients, and then utilize our collective voice to educate policymakers and regulators, that to me encapsulates the importance of patient advocacy and public policy efforts.
I think you expressed that really eloquently and clearly, and it's such a perfect example of how when any one of us gets cancer, we first self-advocate. We become advocates on behalf of ourselves or our loved one. Public policy enables one to then advocate in a broader sense, and it takes you out of yourself, and you don't have to go to Capitol Hill. You can get yourself involved with an organization with a public policy effort and figure out ways to enhance your ability to support public policy advocates, which has become an area of advocacy onto itself.
At LLS, just like at LRF, we talk about the issues of helping patients get access today, and that's a self-advocacy issue. That's us advocating one patient at a time. But then advocacy large, right, is helping change public policy to help a whole bunch of patients tomorrow. And that issue about parity is a great example of it. our perspective has been, and we share this perspective, that where you get your care or what form your care takes, whether it's a pill or an IV or a self-injection, shouldn't be the driver of what your patient experience from an out-of-pocket expense is. So we often, Meghan made a great point, try to translate in English to the patient level, right? And say, well, why does public policy matter to me? It matters because it affects the following important questions for you, among others. Can I see my doctor? Can I see a specialist? Can I go to the hospital that I need to go to? If they tell me that this medicine is the right medicine for me at this time, can I get it? And ultimately, can I afford it? And so those are the things that public policy has a huge impact on. And when patients begin to understand that, they say, whoa, look, I mean, and
Sign me up.
yes, and Dr. Mauro is a great example of having done so much work for one of the premier therapies, the first of the pills that have changed the landscape of disease, but yet create very much, contribute to this issue. It's an oral therapy. And we have patients who will tell us, I went in to fill my prescription and they told me it was $2,000. And I said, well, okay, how long is that? That's 30 days. And then what about next month? Well, it'll be $2,000 again. Okay, but I was just in the hospital last year and I got some IV therapy and it was $75. How is that? And that's because of the way public policy does not serve patients, and that's what LRF and LLS are committed to changing.
Thank you very much for both shedding light and giving perspective to some of the urgency that we face right now.
Thank you.
Thank you.
Thank you very much.